Hello, my name is Austin Wales. I'll be your student massage therapist for today. Today I'll be conducting an active range of motion assessment for your right hip. And what that assessment entails is for me to test out both your muscle and joint mobility at your right hip by ruling out both your lower back as well as your knee. The purpose of this assessment is to give me an understanding as to whether or not you have any restrictions or limitations with regards to your movement. And the benefit of this is to help give me an understanding as to what to do for a safe and effective treatment. Please be aware that sometimes throughout this assessment you might feel a little bit of pain or discomfort as we are trying to reproduce and recreate the pain in the affected area. But with that being said, you have the right to stop at any time. And if you have any questions, you have the right to ask me at any time as well. Please don't be shy. And I'll always be checking in on your comfort level, so please refer back to the visual analog scale, with 0 being no pain and 10 being excruciating pain. And with all that being said, do I have your consent?
Yeah.
Okay. So what I'm going to have you do is try to mimic me as best as you can.
Right.
So if you can touch your toes. Any pain or discomfort?
No.
Can you apply overpressure?
Yeah.
Any pain or discomfort?
No.
Okay, you can come back up to neutral. So what I'm going to have you do now is put your hands behind your back and try to stretch your back as far as you can.
Okay.
Any pain or discomfort?
No.
Can you apply overpressure?
No.
Okay. Any pain or discomfort?
No.
Okay. So what I'm going to have you do next is to lie down on your back on the table, please.
All right.
So I'm going to want you to bring your right heel back up to your bum, please, as far as you can. Is there any pain or discomfort?
No.
Can I apply overpressure?
Yep.
Everything okay?
Yep.
Okay, can you bring it back to neutral, please? And try to bend your knee back as far as you can, but if you can't, that's fine. Any pain or discomfort?
No.
Can I apply overpressure?
Yep.
Everything okay?
Yep.
Okay. So now I'm going to do a couple observations. So I'm going to ask you to bring your right heel back to your bum, please, again. Okay, bring it back. And I'm going to have you do that with your left leg too. Bring it up, and bring it down. Everything okay?
Yep.
So I'm going to move your right leg out a bit, and I'm going to ask you to bring your left leg in towards your knee without bending your knee or moving your hip.
Okay.
So whenever you're ready, go. No pain or discomfort?
No.
Okay, and you can bring both legs back to neutral, please. Okay, and with your left leg again, you can move it, if you can move it outwards, please, without moving your knee or your hip.
Okay.
As far as you can. Everything okay?
Yep.
Back. And now I'm going to do the same thing for your left leg, for your right leg. So, sorry, if you can kindly bring this back out again. So if you can bring your right leg closer towards your other leg without bending your knee or moving your hip again, please, whenever you're ready. Okay. And you can bring both of them back. Back. And again, finally, we'll move this outwards as far as you can without bending your knees or moving your hips, please, whenever you're ready. Okay. Good, you can bring it back. Okay, so I'm going to do a couple measurements in terms of your affected leg. See whether or not there's any restriction or limitations. So I'm going to have you, again, bring up your right leg back up to bringing your heel back up to your bum, please. Thank you. And bring it back down, please. And I'm going to ask you to move out your leg again. And again, without bending your knees or moving your hips, I'm going to ask you to move your right leg closer towards your other leg, please, whenever you're ready. Thank you. You can bring it back. And lastly, I'm going to ask you to again bring out your right leg outwards as far as you can without moving your hips.
Okay.
Or bending your knees, please.
All right.
Okay, please, whenever you're ready. Okay, you can bring it back, please. Then I'm going to have you turn around with your stomach on the table, please. So again, I'm going to do a couple observations prior to measurements. So if you can bring your left leg up without bending your knees as far as you can.
All right.
Whenever you're ready, go. Okay, bring it down. I'm going to ask you to bring your right leg up this time. Okay. And bring it back down. And then bring both of your knees up to a 90-degree angle. I'm going to ask you to rotate this one inwards and rotate this one outwards whenever you're ready. Go. And go back to neutral. And without moving your hips, we'll try to move this one inwards and this one outwards. Whenever you're ready, go. Okay, back to neutral and back down. So now we're going to do some measurements to finalize the assessment. Sorry. Okay, what I'm going to have you do again is bring up your right leg without bending your knees and bring it up as far as you can, please. Whenever you're ready, go. Okay. Back down. And then I'm going to ask you to bring your right leg up and bend your knee to a 90-degree angle.
All right.
Okay, perfect. Okay. Whenever you're ready, I'm going to ask you to bring your right leg and turn it inwards. Ready? Whenever you're ready, go. Move back to neutral. And again, whenever you're ready, I'm going to ask you to bring your right leg and move it outwards. All right, whenever you're ready. Okay. And you can bring it back down. And that concludes the assessment for today, so you can get back up.
All right.
And you can put back the things. And everything seems to be okay, and I hope to see you again next time.
All right,
Thank you.
thanks.